Welcome to Chamber Chat. This is John Tayer, President and CEO of the Boulder Chamber, with our bi-weekly opportunity to check in with our Boulder Chamber members and the Boulder business community at large to talk about issues that are important to your business success and what we're doing here at the Boulder Chamber to help lift you and support you during these difficult COVID-19 times. And today we have some important guests who are going to talk to us about our vaccination program in Boulder County, which, as you'll hear, is critical to getting through this current pandemic and back to business. But before we talk to those individuals, just to have a couple of announcements. First of all, I want to make sure you know about our upcoming Celebration of Leadership. This is our annual opportunity to honor those important and just valued civic and business leaders who have helped address our economic issues and needs and have been great champions of the business community at large. And we want to make sure we're paying tribute to them. So again, this year on March 9th at 6 p.m., we will have that Celebration of Leadership. And it's sponsored this year by our great friends at FNBO. Now, given the COVID environment, this will be a hybrid event where we'll have the guests live, our honorees, but all of you will be able to watch from the comfort of your home, the couch, whatever is comfortable. But you do not want to miss this. We're going to have special celebrity packages, surprises, all sorts of things to keep you entertained, but at the same time appropriately honor great civic and business leaders in our community. So make sure to join us for the Celebration of Leadership. That's on March 9 at 6 p.m. And then second, we have our upcoming business after hours, and that's on February 24 from 4 to 5 p.m. And this is going to be a dynamic speed networking session, an opportunity for you to quickly connect with a number of business leaders in our community, get their contact information, build your network, and support your business through this great 2021 revival economic year. So we want to make sure you're going to be there, meeting our business leaders. So be there for the business after hours on February 24. So that's enough from me about activities at the Boulder Chamber. But now I want to introduce our two guests. We have Christopher Urbina, who is the medical director for Boulder County Public Health. And we also have Chris Campbell, who is an emergency management coordinator for Boulder County, and he is the COVID-19 testing and vaccination lead. And these are the people who are guiding us through the vaccination program, as I said, which is critical to get through the pandemic. So my first question is for Christopher Campbell. And Chris, I'm just wondering if you can just please tell us about the status of our vaccination program. How's it going? How many folks have you been able to vaccinate? What's the progress, and any challenges you may be facing with the vaccination effort?
Absolutely. John, thanks so much. And I really appreciate the opportunity to connect with the community members and the business community. Again, my name's Chris Campbell. I'm the emergency manager with Boulder County Public Health. And as John mentioned, working with incredible folks across the county to work on our vaccination administration plan. So just some updates on our status and how we're doing. We have thus far vaccinated with our first dose in the Boulder County community, 22,128 community members. Additionally, 20,599 community members have had that full course, which is critical, and fully vaccinated. So that number that we're looking at with community members at least have one dose of vaccine in Boulder County is about 42,700 community members. So we are making slow but steady progress, and these are great numbers. I will certainly add, and just to put a finer point on those numbers, many folks know that we're following the statewide phasing plan. And so this has started out, we focused early on with frontline healthcare workers that are really involved very closely with working with community members that might have COVID. We've moved very diligently through that group. We've also worked with first responders, essential workers in public health and really that are helping with our COVID response. That group is, we're working through that, nearly through that group vaccinating those community members. And then we also have 70 plus community members that we are now vaccinating, and that's been going on for several weeks now. We've been able to vaccinate with one dose 70%, almost 71% of our 70 plus community members in Boulder County. And most importantly is actually we're starting to then move through the second dose with those community members, and about 35% of those community members have been vaccinated. And we have now added an additional group of 65 to 69-year-old, those community members, and we're already making progress on those. So we vaccinated just about 20% of those community members. So, it's all good progress, and we've been perfectly transparent with the community in other forums. It's not a perfect system. There are challenges with signing up right now. We know that. And we would just continue to encourage the business community and community members to go to our website. We have all the providers currently on our website right now that are providing vaccine. If you fall in one of these eligible phases, please go sign up. If you, for example, already have an existing relationship with a hospital, we would very much encourage a community member to sign up with that hospital. You will get a message back. You will get an email back when an appointment becomes available. And I'm starting to hear from our providers that as we're getting through these groups now, there's some open slots. So you should be hearing from providers. Certainly it's taken a little while, and that can be frustrating, but we are making progress. Globally, just to put a little more structure, just to talk about our vaccination strategy. Our vaccination strategy is threefold. So we are leveraging the current provider infrastructure we've created. We've got 32 providers that really have significant capacity. If we got a full vaccine allocation in Boulder County, we could be doing 22,000 vaccines a week with that provider infrastructure. Unfortunately, right now, our vaccine allocation for Boulder County is about 7,000, 8,000 doses a week. So, we have that structure built. It's ready to go. Again, it's not perfect, but it's ready. And so we hope that, and we know that the vaccine supply is going to increase. It's probably going to stay stable like this, the 7,000, 8,000 doses for the next several weeks. And moving into April, March and April, those numbers are definitely going to go up, and I'll talk about some other strategies we have there. Another part of our strategy is really a focus on health equity. We know that there are community members that really have barriers to accessing vaccine. These are they grapple with systemic challenges, historical challenges about accessing the health system. We know there's geographic barriers, community members in the peak-to-peak areas, for example. We know how transportation challenges. So we have a couple strategies that we're already implementing that include both community-based vaccine clinics. Those will be really driven and given input from community members directly about where it makes sense to locate these clinics, so community members can access vaccine in an environment they're familiar with, and is closer to where they might live or work. In the mobile clinic strategy, we have a mobile clinic strategy. It's much smaller, and right now they're, for example, working with older community members that might be in congregate settings or independent living. So these are, that's another strategy we have, and we're implementing that currently. So, and then our last strategy is, should for some reason we see just an influx of vaccine that comes to Boulder County, we want to identify some mass vaccination sites. So these are likely 3 sites across the county that we have identified that really could do a large amount of vaccine on top of this existing infrastructure. We just want to make sure we're ready. And you might have seen some of the, across the metro area, some of the bigger clinics like that the hospitals have held at Coors, for example, or at Pepsi Center. And these would be something like that, maybe a little smaller, but again, something that could do basically like 1,000 vaccines a day, 5,000 vaccines a week, and 3 sites across the county, that's an additional 15,000 vaccines. So, that's our strategy right now. And we're in different phases of implementing it. There's a lot to the health equity strategies that I certainly don't need to go into, but I could come back and answer some questions about that. And maybe in some of the subsequent questions we're going to answer, we'll talk about vaccine education and what we're seeing with community members really understanding why they want, take the opportunity, should it make sense for them to get vaccinated. Some challenges, just to mention them, I think as we've seen the shifts in the phasing plan for the vaccine allocation, this is very, very much driven through the governor's office, to be just very transparent. And we've provided input, but it's sometimes there's changes made to that plan that we're hearing about honestly last minute. And it's fine. We understand that, and we're working through it. But for example, when we when the community members 65 to 69 added to the eligibility, which we definitely agree with, that added an additional 17,000 community members, basically to the line to get vaccinated. And we still weren't even through. We at that point, I think, had 50% of our 70 plus community members vaccinated. So. Just what I would reiterate for the community, it's a really challenging message, is patience right now. We want nothing more than to vaccinate all community members, and we foresee a time where that vaccine is going to be available to any community member that wants to access it. So I just, that's some challenges we're seeing. Additionally, when teachers, early childhood educators were added to the eligibility, that added an additional 10,000 community members. Again, I think just because, just to mention the community and business leaders, just because your group comes up and you're eligible, we still have a limited supply of vaccine, and we're diligently working through the group. So it doesn't mean on that day one, everyone's going to get vaccinated that day. With that said, it is our goal to work with the phasing plan and to work with leaders in the community to ensure access to vaccine. So one last thing I will add, John, is this phase 1B3, which is definitely going to impact businesses throughout Boulder County. It's going to be a challenging one for us to work through and implement. We have very little guidance right now on this phase. Frontline essential workers in food and agriculture and manufacturing, for example, is a very large group. We are looking forward to that, and likely what you'll see is, again, leveraging the current infrastructure we have. So businesses are going to, be able to access vaccine through the providers, and I didn't mention all the providers, but it's the 5 hospitals in the county, the clinics in the county, federal qualified health centers like Clinica and Salud. We have great partnerships with King Soopers pharmacies and Safeway pharmacies. CU as a provider as well. So all these providers together is going to be where businesses are going to be able to access vaccine, again, as we diligently work through these phasing. We will also, just to mention those health equity strategies, is community-based locations. Those are another good opportunity where we can work with businesses to ensure community members they know might have barriers to access. They could go to these community-based clinics that are closer to and more comfortable to go access vaccine. So I just wanted to mention that to all the business community that are listening today.
Chris, I appreciate what an enormous effort this is, and I'm thankful for you outlining just the magnitude of the operation and also your sensitivity to the equity issues. So really important that we are all understanding the priority and how it goes forward. I've made my pitch to you before for chamber directors to get up higher on the list. Apparently carnival barkers and chamber directors are neck and neck there for the bottom of the list. But anyway, really important information. So with that, I'm going to turn it to Dr. Urbina. And a question for you is about, we've heard now the program that is being implemented to vaccinate everybody. But just if you can tell us a little bit about what is the vaccine that we are seeing through in our community, and what resistance does it give us to COVID-19 and then the other strains? And then for those who have been vaccinated, what level of flexibility can they now anticipate in their lives? I mean, are they able to go without masks? Can they, get closer than 6 feet? Can they go on a cruise? I mean, what can you tell us about that?
John, thank you for the invitation. And as you can hear from Chris Campbell, this is a very complicated structure. And I think we've had great cooperation by local businesses, our healthcare systems, our healthcare providers, our pharmacies, who are part of our business community. And I think we're doing as good a job as we possibly can. The deficit is the lack of vaccine. And you can't vaccinate tens of thousands of people without vaccine. So I just wanted to give a shout out to Chris Campbell and Tayer and the entire team who've really done a great job of coordinating this effort with very little resources. It's the same team that's been working on this for a while. So I really want to appreciate them and thank them for their efforts. Now back to your question, and I think it's an important one. As you heard from Chris Campbell, is that we're still in the early stages of vaccination. And so we still have a ways to go before we can theoretically get as many people who want the vaccine. And most of the scientists, experts in our country say that we really need to get vaccinations up to 60, 70, maybe 80% of our community before we can safely say that there are less susceptible people in the community. And we can talk more fully about that. So in the meantime, it's still important to wear your mask, to observe physical distancing of at least 6 feet, of washing your hands and disinfecting surfaces, avoiding large social gatherings, particularly of people outside your household. Those strategies are very important as we continue to vaccinate the number of people highest risk first, as Chris Campbell outlined. And as we go through the community, we're going to get more and more people protected. Particularly, I'm very excited about now vaccinating the teachers and early childhood education workers, which I think allows our schools to open up more carefully and a safer way. But all of those strategies are important to protecting our community from this infection. So if you think about it, if we protect people with those barriers, those prevention strategies that we talk about, we vaccinate the most vulnerable, and as we get more and more vaccines, then really the virus has no place to go, does it? So that it's going to be a while for us to do that. And hopefully by summer, next fall, we'll have everybody that was as eligible to get the vaccine will get that vaccine. And hopefully we'll have better news about children and their accessibility to vaccine, because we still don't have kids eligible for the vaccine yet. So it's going to take a while for us to immunize the entire community. So during this period of time, there are still going to be people that are susceptible to the vaccine. And as long as people are susceptibility, the virus has a place to start and to replicate. Now let's talk about that question of the variants. We've known for a long period of time that viruses mutate. That's been true of all viruses. You can think about the influenza vaccine. Every year we give you a different strain of the vaccine because the virus continues to mutate. That's not true of other viruses, but it happens to be true of these respiratory viruses like coronavirus. So currently the two vaccines that we have, Moderna and Pfizer, have shown to be effective against these two, the 7+ variants out there, although you hear mostly about the three most common, which are the UK variant, the South African variant, and the Brazilian variant. The vaccines that we have appear to be effective against those against those variants. Now, obviously, the predominant variant, we know it's 94 to 95% effective, and that's a good thing. We're thinking now that maybe the vaccine that we currently have is less effective against those new variants, but still effective. Maybe not as good as we had hoped for, but it's still effective. So I think when you combine the protection that we talked about, those mitigation strategies and the vaccine, against the new variants, I think people can continue to do their usual activities. But you have to be mindful that not everybody is vaccinated, has their vaccine. So it's going to take a while. So can people proceed with their normal activities? Sure. Wear a mask. Physical distancing avoids large crowds so that you can protect yourself and others, because no vaccine is 100%. We know for sure that these vaccines prevent serious disease. You can still have a mild infection that's maybe asymptomatic, but it's still effective at preventing severe disease. And so we still are going to be in the throes of doing those prevention strategies. So I think, after you've been vaccinated, can you safely go to grandmother's house? Yes. But your grandmother has to wear a mask, and you should continue to wear a mask. You should still use those prevention strategies. But you can prevent severe disease from your grandmother. She's hopefully she's one of that 70% that Chris Campbell talked about that got their vaccine. But if everybody gets their vaccines, then the risk of having severe disease is certainly less. So my advice is still continue to use prevention strategies when you're traveling, when you're visiting your grandparents, particularly if they have those severe diseases that we talked about early on in the pandemic. Use precautions, but it is, as we vaccinate more and more people, we use these prevention strategies, our world will open up more and more.
Well, let me talk to you about that, Dr. Urbina, and just that sense of when we have finally gotten to the point where we vaccinated the significant majority of the population. What is your expectation as a professional in the field of future resistance to COVID-19, other similar viruses that are variants of that COVID virus? And then what do you think are then the impacts for the future of normal business activity, normal recreation activity, the ability to go to concerts, things like that?
Sure. Let's first talk, John, about the virus itself. Now, in the history of virus and virus infections and vaccinations, for the most part, over time, as we increase the amount of people that are vaccinated and we protect the folks that can't get the vaccine by using those prevention strategies, then eventually the virus will disappear. It will eventually not have a susceptible person or host to replicate. So it reduces the amount of variants out there by getting as many people to use the prevention strategies, plus the people that have already gotten the infection, plus we are adding vaccinations about that. All of that decreases the likelihood of having spread of this virus and keeping it from mutating. If you look back at the history of pandemics, generally the virus weakens over time, so that the first time we're exposed to a virus, it's very serious. A lot of people hospitalized, lots of deaths, and we've seen that in the United States and across the world. But over time, the virus weakens itself, and probably because some of those changes that we talked about, and eventually they become less deadly. If you follow influenza every year, sometimes we have a strain that's very, very potent and leads to significant disease. Other years, we have strains that are less potent. So I think we don't have a crystal ball regarding this virus, but as we can control the spread and we can prevent the severe infection, eventually that virus will weaken and we'll have less people that have significant disease related to these viruses as they weaken in the future. Now, that's just a history of how viruses spread. We don't have a crystal ball whether or not this will become more virulent, but I know we have prevention strategies that actually can make that happen. And if it weakens, then I'm hopeful that we can go back to a new normal. I mean, I think we're still going to have to be protecting ourselves. And you remember the days, John, when you were growing up, did your mother say, wash your hands, cover your cough with your arm? Of course she did. And we should, and of course, if we continue those strategies, we'll probably have some of those strategies in place. We'll probably, no big sloppy hugs, no big sloppy kisses, because we're trying to prevent not only this infection, but future infections like influenza and other infections. So we still have a ways to go, but I'm hopeful that those changes will happen with this virus and others, like it has in the past, but only time will tell. And right now, what we can do is do all of those things that we talked about to stop the spread and gradually open up businesses, gradually go back to normal activities with some caution. And with those cautions, I think that people can travel. I think that people will be able to go to indoor dining. You know, if we increase the circulation, if we're washing our hands, we're wearing our masks while we're not eating, there are lots of things that we can do to prevent the spread of infections now and in the future.
It's very encouraging. And you know, it does demonstrate that our mothers were right after all, right? Is that accurate? Well, I'm just going to pull the same question to Chris Campbell and just wondering if, you know, as he looks out over the horizon, what are your expectations for the getting back to normal and the opportunity that the vaccination program that you're implementing presents for the future of normal business activity and recreation?
Absolutely. And John, thank you for that great question. There's a couple points I really want to reiterate for the community, and I think business leaders are going to be critical and very important in helping us get this message out. What we know about these vaccines is that they have been incredibly effective against severe illness and hospitalization. And it's just very important as a community to focus on that and to work together. And if folks have questions about the vaccine, bring them together in these forums. Answer those questions. We know we have learned a lot. For example, I'll give a really good example. There has been a lot of focus on adverse reactions to the vaccine. They have been remarkably low, something like 2 in every million vaccines that have been administered in the United States. We've seen and some kind of adverse reaction, just remarkably low. So these are safe, effective vaccines. They went through a rigorous trial. They're based on technology that has been actually in development for years and years. And it's just remarkable actually to see how effective they have been. So we in order to get out of this pandemic, to end the pandemic, we will need the community to come together. And if folks think it's the right decision for them to get vaccinated. So that's what I would like to leave and the business communities really needs to help us with this messaging. The vaccines are going to protect not only ourselves, but friends and families and other community members. So it is just going to be really crucial for folks to be informed and make the choice to get vaccinated.
I love it. Well, I just will say, as you helping us to convey that message, you both are excellent messengers. I have just great confidence based on this conversation, but also I know the work you've been doing in our community to guide the vaccination process and to help us understand the impacts of COVID-19 on our public health. So thank you so much to you and the rest of the public health team. You've been just such valued guides through this very difficult period. And we will get this message out, and this chamber chat is one of those efforts. Thank you so much, Dr. Urbina, Christopher Urbina, for being with us, as well as Christopher Campbell. Thank you so much. So that's another wrap for our chamber chat. Just a couple of reminders. We have our celebration of leadership on March 9th. Be there to help us honor great civic and business leaders in our community who help strengthen our economy and support our community. And then also we have our business after hours, which is on February 24, speed networking. It'll be fun. It'll be a great way to build your business connections. And so I conclude my chamber chats every time with that public health warning. And I'm not just doing it because Dr. Urbina and Chris Campbell are here in front of me, but I say, listen, we all can play our part in suppressing the virus and getting us back to business. And one part you can play is always make sure to wear your mask, and we'll see you next month on Chamber Chat.